The wayfinding landscape is changing, so welcome to Endpoint's new Wayfinding Xchange Podcast. We want to connect with digital and tech specialists to exchange knowledge of new technologies and wayfinding solutions. We want to shape the future of digital wayfinding through discussion, collaboration, and shared expertise. And this is why we have created this new podcast series. Enjoy the episode.
So, hello everybody, and thank you for listening to our new podcast episode. When you visit a hospital, have you ever lost your way or found it difficult to locate your destination? Probably, I know I have. Today, we're very happy to have Ralph Michels, CEO of Eyedog, joining us to share more about mobile wayfinding and hospitals and healthcare. So, yes, Ralph, thanks for joining us. I've been looking forward to meeting you and finding out more about the Eyedog software, because it looks quite different to a lot of the technology out there. So, I guess first general question: tell us about Eyedog. Tell us about where you've come from and what you think makes Eyedog different.
Thank you, Gideon. Thank you for having me in the podcast. Well, it's actually quite a. The story goes back quite a long time. It was, I think, around 1996 when I was doing my master's at the university. From a background, I'm a civil engineer, but I did my master's at mathematics and computer science, and it's now called geomatics. So I was doing my master thesis in that area, and my dad used to work for the Modelex organization in Denmark. So he has he joined, I think, in the late 70s. So he was already there for 25 years, and in the end he was there for almost 40 years, and he was very busy with wayfinding in healthcare. And back then in the 90s, I told him one day there are going to be devices, and there were not even there were Nokias by then. There will be devices that will tell people how to walk in complicated indoor environments. And he said, "Yeah, you might be right." And we discussed it until 2014. And because I knew from a technology point of view how to approach this, but from a UX point of view, that was challenging. And I discussed it many times with my dad, and it was just at birthday parties or at Christmas or whenever we saw each other, the topic came up again, and he said at least 50 times, "No, this is not gonna work." Because you have to imagine, hospitals are first of all very complicated environments because they are built over time, a different architecture. People are under time pressure. People are stressed. There are also many changes in hospitals, and these are all things that you have to think of. And there was always something that he said, "No, this is not going to work because of this or this or that." And then there was around 2012, 2013. I had this eureka moment, and I discussed it with him, and I said, "What do you think about this?" And then he looked at me, and he just hesitated for 5 to 10 seconds, and then he said, "And this is going to work." So that was the start, and then I decided let's go for it, because I had a very good feeling about it. And especially there was one thing that he learned me: in hospitals, keep away from using maps. He said, we used maps only, for example, when at the Philips campus in Eindhoven, because there were lots of technical people with they're wired in a different way, their brains, and they could use maps, but don't bother people with maps in the hospital. And so that was the reason to use a completely different approach, and until now it's pretty successful.
Yeah. So, I mean, tell us about the development of the tech, and I understand your reasoning for avoiding maps. So your app works in a different way. It's not a blue dot sort of following the a digital map around a campus. Tell us a bit more about how what that UX is like.
Yeah, we are using photos that are taken at key points, key wayfinding points in the hospital, and we tie them all together. It's like if I would, for example, go out the door after this interview, and I would ask you, I'm with my car, and I would need to find a gas station because I need to fill up, I need to gas up. Then you would say, okay, you go out here, and then on the first roundabout, you take a left, and then you keep on going until you see a red building. You go to the right over there. What people do is they virtually take pictures in their mind of that situation. It's not the same situation as what they will see, but when they see it, they can immediately relate to that. So when you have just 3 or 4 instructions, that will be fine. But in the hospital, you have so many turns and bends that you might need 20 to 30 instructions, and you cannot memorize them. So that is why you need to bring that route with you, and it's like a narrative, but only using visual elements, pictures. And pictures are taken from very specific places where you have to make a wayfinding decision, or at places where there is a landmark that is a salient object that is really recognizable for yourself. So that is how we approached it. In the first, that was in 2014 when we built our prototype, and we went also live with a few clients. We used an app for that, because at that time it was booming to make apps, and we thought, we can make a wayfinding app, and but that was a hard lesson because in hospitals people are not downloading apps for wayfinding. Some clients of us, they tried at, let's say, at the welcome desk. Oh, you need to go to orthopedics. Oh, you can download here an app, and they say, oh no, just tell me where it is. I'm not going to download an app first. I'm nervous and I'm not on time. So that is what we learned. Don't use an app, and don't use maps. So after 2015, 2016, we completely rebuilt our platform and ditched the strategy for app only, and we are now API only, to make sure that the wayfinding information can be integrated in crucial touch points for the patient.
Okay, I mean that's really interesting, because we've done a lot of hospital work over the years, and my colleague Alison's super passionate about hospital wayfinding, and she actually helped write some of the NHS wayfinding guidelines many years ago before she joined Endpoint. So she has a real expertise and passion for the area. And having done quite a few of these podcasts now, and it sort of goes against convention, this idea of not downloading an app and not using maps. And I think it's really interesting if we could talk about that a bit more, because I've found, and I know clients who we've worked with have found that barrier to actually downloading a dedicated app is a really big wall and a really big barrier. You spend hundreds of thousands developing these things, and then no one downloads the app. It's really tricky. So explain to us how these images are delivered to your, I guess it's delivered to your handheld device, your phone. So how do people connect into that? How from a user interface point of view, how do you access the navigation? Is it through some other app, or is it Wi-Fi related? How does it generally work?
Yeah, that's a good question, because when it's it actually comes from our APIs, and that's the back end. But you need to bring that information to the front end, where it can be, where it faces, where it's becoming customer facing. And there are many ways to do that, and that's also one of the reasons why because when we started, what we did was we focus on everything in the market, so everything that is indoor. So not only hospitals, but also, let's say, museums, universities, uh, airports, cruise ships, you name it. But then we realized when we chose for an API strategy, it's really important to understand how people behave in a building. And when you go to a mall, people behave differently than in a hospital. So we took a closer look at the patient journey and how that is globally and in general being organized. And there are lots of similarities all over the world when it comes to that. And it is actually well, in a hospital, you have actually two people. One is the patient, and one is the visitor who's coming to visit a patient who's hospitalized. And we first focused on the patient itself, and everything is built around the appointment, because that is the first point of contact that you will have, and that can be done in different ways. You can send an email or just a simple letter, or but they can have a patient portal that they can access on through the website, or a patient portal that is on in the app. But everything is tied built around the appointment. And we also don't want to bother people with an app where they still have to select where to go. I think you should just give patients contextual wayfinding information. So if I need to go to orthopedics, I don't want to be bothered how to find my route to cardiology, because that's not relevant to me. So the patient onboards through the hospital information system, the EMR, the electronic medical records system, like Epic or Cerner or Oracle now, or in Holland we have Chipsoft, for example, or companies that build around some layer for patients to access their appointment information, and there you can integrate it, and it's super simple. It's just a couple of hours a work, and really a couple of hours. So it's not that I say a couple of hours and it takes a couple of weeks, but it's really a couple of hours. It's very simple. So that is one touch point, but you also have a touch point when you arrive at the welcome desk. Say, okay, I don't have my appointment details with me. It's somewhere in my phone, but I need to go to orthopedics. Oh, let me generate a route for you. For example, on a tablet, they swivel it over, contactless. You can scan the QR code. You get your route from that welcome desk to orthopedics. And you might get a forwarder from orthopedics that they say, you need to have some X-rays. So from orthopedics to radiology, you can scan the QR code over there. And so we actually take the user, the patient by the hand, and guide him or her through their whole patient journey without having the hassle to find your location. It just smoothly ties into to your personalized journey.
Yeah. So it's sort of, these journeys are delivered through your phone's browser, essentially. Is
True. True. Or through an app, because, for example, if the hospital has a patient app deployed where you could check your appointments, your medical records, your lab results, then you can go to your appointments and see, oh, tomorrow I have this appointment at noon at orthopedics at this hospital. Then you can already prepare from home, because what we do is we build a specific journey for that patient to get from home to the appointment and back. So that is bring the patient by public transport, but also by car. For example, if you have big campuses, you don't want patients to drive to the other side of the campus while they need to be at this side of the campus. So giving them exact driving directions to exactly where they need to be, where to park, alternative parking, what the entrance is for them if they arrive by car, what the entrance is when they arrive by Uber or taxi or whatever, they get dropped off, and then from that entrance, how to get to your appointment.
Mm. So, if there's potentially clients listening to this podcast, what are the sort of, if they're interested and terms were agreed, what's the process you have to go through to create these specific journeys. I guess, I'm just thinking aloud here. I'd imagine there's multitude of variations of journeys within a hospital environment. How do you work that out? Do you just look at key journeys, or is there some sort of clever algorithm they use? And then what do you have to send a photographer to go and walk all these journeys? How what's the process of getting this thing up and running?
Yeah, it's actually not that hard. For let's say a hospital of 100,000 square meters, it takes us around 2 weeks to map everything. It's indeed complicated because you have to realize, let's say, for a hospital which is of the size of 100,000 square meters, which is pretty significant, there mostly will be 150 to 200 indoor locations. It's not only the medical service that you want to map, but also amenities like a praying room or a cafeteria, something like that. And sometimes they also want to use it for staff, and they want to highlight all the 18 meeting rooms that they have. It's actually used quite a lot, and this takes around, like I said, 2 weeks. And but if you have all these indoor locations, let's say you have 200, I think in hospitals, I think that's a design requirement. From every point in the hospital, you should be able to find any other point in the hospital, especially at junctions where you can make a wayfinding decision. You should be able to find any location. You could, for example, in signage, you could have just missed one queue, and you go to the next decision point, and then you don't see that queue anymore towards your endpoint, and that's bad. That's a bad experience. So we make sure that you can find any location, from any location to any location. And for example, if you have 200 indoor locations, this means that you have 200 times 199 is almost 40,000 different routes. And that is not including the routes for the physical impaired. So that will come on top of that as well. So there has to be a clever algorithm, because imagine that you would have, let's say, 6,000 routes going through one elevator, and one day you have to shut down the elevator because it's maintenance. Then you have to do manually. You have to change these 6,000 routes. That is
Yeah.
of course impossible. So there is some algorithm behind it, and that's absolutely not rocket science. That is the same algorithm that Google Maps uses. It's a Dijkstra algorithm. Once created by a Dutch computer scientist, Edsel Dijkstra, in the 50s, and that is still widely used, that algorithm. But you have to cleverly use it to make sure that you can put all these photo instructions in the right sequence, and also augmented with graphical instructions and text and navigation instructions in graphics and in text on top of that. So we map the whole building like that. We take pictures at key points, and then the system does the rest.
It sounds amazing, but then a lot of these systems do, don't they? So tell us, how many hospitals are you in? How many people are using your system? Some of these clients, test bed for you in terms of trying new things, and is it mainly in Holland still at the moment? What's your customer base?
Currently, we have the most installs in Europe and in the United States. In the United States, actually the most. We have around 50 hospitals that we are doing, and most of them are in the United States. And I was kind of surprised that it took off there first, but after all, now when I look back in retrospection, I do understand it. The US has already started really early with a focus on patient experience. And you also see in the US that these health systems are competing with each other, and also that patients do expect more and more a retail experience from their healthcare providers, with effective and personalized communication, empathetic communication. And that is why they invest in tools and solutions to boost the patient experience. So I think that's the reason why it took off in the United States earlier than in Europe. But we see that here now, especially in the Netherlands, we see that coming here as well. Customer-facing applications to improve the patient experience, and yeah, a key point solution to that is digital wayfinding. You almost see that, especially in the US, you see that they are if they know they have a wayfinding problem, they immediately go digital and not think of how can we improve the overall wayfinding experience, because not everybody is digital savvy, but still I see two silos. One is the wayfinding design that purely leads to science, to static elements, and on the other hand, you see the silo of digital tools that purely lead to a digital solution. And I think that's a shame. I think there should be a much more holistic approach, especially now in hospitals. You see all communication is going digital, so I think you should focus on digital as well here. But I'm missing the holistic approach, and I think those two worlds should start cooperating together.
I couldn't agree more. I think we've talked about it previously on these podcasts. The exactly that, this idea of these silos. I mean, we've worked on numerous projects where we know there's a digital project going on with a different internal client stakeholder, and we're working on the, like you say, the static wayfinding signage. And it's like we need to be collaborating and working together more, because the systems need to work together for a seamless experience. So I completely agree with that.
And you have two different kinds of people. There are people that want to stay offline, and people that want to stay online. Especially hospitals are more and more communicating online, and I think it's important to serve these patients as well.
I mean, just finally on the product and how does the client pay for this? Is this a SaaS type service, or how does it normally work in that regard?
Yeah, it's a SaaS service. We charge for initial setup, and after that it's a software as a service, and also a managed service for keeping up with changes. For example, if the ED moves from one side of the building to the other side of the building, and that has all been taken care of. And yeah, that's what we call wayfinding as a service. Especially in the United States, there are also services around it for creating adoption. Because we see that is very important. You need to train the staff as well to make sure that they can communicate to patients how to onboard the system. For example, if the staff at radiology does not know that there is this application, or that there are some QR codes installed and they have no clue why that is, well, they should learn and know that, of course.
From our experience, working in healthcare environments, that that is one of the key challenges is actually the operational side of the hospital. And firstly, having someone who's responsible either for patient experience or even wayfinding, because like you say, there's so much change that happens within those environments, from personnel changes, consultant changes who may want to change the name of their department, to capital expenditure changes where they're moving whole departments and closing wards, building new buildings. And it's we often go into hospitals, do an audit, and it's an absolute mess. And it's usually because internally they've not got the systems and workflows to keep this sort of everything up to date and live. So I think a digital system could definitely help with that.
Yeah, it helps, but still you need to convince the client that there should be at least one person who is responsible for collecting all the changes in the building. Whether it's let's say a paint job that they will do new carpeting or whatsoever, there needs to be some central point where they should collect this information, especially these kind of little things, because we use photography for that. And of course, we did some testing, and if you see, let's say, a red sofa and all of a sudden it's a yellow sofa, people won't get lost because of that. But still, you would like to keep it fresh. And luckily, most of our clients found some ways to organize that in a very simple way. They communicate with us on 12 December, Monday morning at 9 a.m. You have to make sure that this hallway is shut down for maintenance, and we make sure that it's shut down for maintenance. They can also choose it to do it completely themselves, but most of them tried it and they say, no, it's better if you guys do it. It's easier, it's faster. So that's the way how it goes.
Right. It does sound amazing. I mean, I don't suppose. Do you have is there any hospitals in the UK, just in case people want to test it out? I know it's a big field here. There's lots of our friends and I guess competitors who work in that sector. Is there examples they can see in the UK, or do we have to travel to Holland?
Unfortunately, you have to travel to Holland.
I love Holland.
To be honest, we haven't tried really hard to get into the UK market. Despite that, I know that it's a huge market and a very interesting market. We have been focusing mainly on the United States, Belgium, the Netherlands, and Spain. And actively when it comes to sales, we would love to get into the UK market and at least find a health system that is willing to do a test with us, and we can do a pilot with them, and also a full pilot to map the whole building, and they can just test. Because we really would like to convince the UK healthcare market that this is really, well, I'm biased, of course, but it's the best mobile wayfinding system out there. It's so exact and so precise, and it performs so well because we measure that. So yeah, if hospital systems are listening, then they can contact you, and you can contact us.
Well, there's the challenge. So either some healthcare providers or wayfinding colleagues, speak to Eyedog if you have an opportunity to introduce digital wayfinding into some of your clients' environments. I mean, on that, I'd actually love to carry on speaking. It feels like we've only scratched the surface, Ralph, but
Sure.
we try to keep these to about half an hour. Just let everybody know, how could they contact you? What's your website address?
Well, the best way to contact is you look at our website, www.eyedog.mobile. It's spelled Eyedog from seeing Eyedog. That's where the name comes from. And people can obviously drop me a line as well by email and at ralph@eyedog.mobile. But obviously they can also directly contact you, and yeah, maybe that's easier for people.
Brilliant. Okay. Well, look, Ralph, I've really enjoyed that. I'm desperate to try and experience this because it sounds magic. No app to download, no maps to try and follow, no massive amounts of infrastructure for clients to install. So it sounds like you're on a really interesting track, and I'm sure there's opportunities beyond healthcare, which I'm sure you've explored. And,
Sure.
and maybe we should have another chat one of these days and talk about that.
Love to.
But
Yeah.
for now, I've really enjoyed that.
Thank you.
Thanks for your time.
Thank you.
And if anyone wants to get in touch with Ralph, Eyedog dot mobile or
Mobi,
.com.
MOBI.
I think everyone should check it out. It sounds really fascinating. So yeah, thanks very much, Ralph, and hopefully we'll connect again.
Thank you. Yes, hopefully.
Thank you for listening to our latest Wayfinding Xchange podcast. Stay tuned for further episodes and feel free to contact us with any questions and suggestions for future episodes.